Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. Hello. Today I have with me Rachel Roudik. Rachel is a labor and delivery nurse, and she is the mother of two. Rachel is someone that I work with, and we were kind of inadvertently a part of each other's birth stories, and she is here to share her birth story. Welcome, Rachel. Thank you so much for joining me.
Thank you so much for having me.
So, do you want to go ahead and start with your first birth story, even though it was kind of less eventful?
Sure. So, my daughter turned 4 on December 6th. She was my first pregnancy. I had a relatively uncomplicated pregnancy. I decided to have an elective induction just over my due date because as a labor and delivery nurse, you know all the things. And so I just decided to go ahead and get an induction. So I was 40 weeks and 2 days the night that I went in for my induction. I think 40 weeks and 1 day. I had her when I was 40 weeks and 2 days. So I was 40 weeks and 1 day when I went in for my induction in the middle of the day. So I was a 1 p.m. induction slot. So what that means is I got there, they kind of, asked me all my millions of questions, put my IV in, and then they gave me a little pill called Cytotec that you kind of stick in your cheek and it sits there. And kind of let the process begin. And right away, my body kind of was like, okay, I guess it's time, because I was contracting every minute or two, although I wasn't really feeling much in the beginning. And around 6 p.m. or so, I felt this little pop and was talking to one of my coworkers who is also a friend. I was like, I think my water just broke. And so we did the things where you put a pad on with some underwear to kind of see if that's your water or not, to see if it continued leaking. And the doctor came in and evaluated me probably an hour or so later and wasn't super convinced that my water had broken. But seeing as how I'd been a nurse for about 6 years at that point, I was kind of convinced that that's what it probably was. So they then decided to use a medication called Cervidil to proceed with my induction. They put the Cervidil in, and that's when things started to get a little bit more uncomfortable. I did continue to leak fluid. I did continue to contract. I thought I would take a little bit of a nap. At this point, it was like 10 or 10:30 at night or so. So I put a movie on, laid down in bed. My husband had just switched jobs about a month and a half before we had our daughter. So he was trying to work a little bit extra to save more time for when we had the baby at home, since he wasn't going to get a huge amount of leave. So I laid down thinking I was going to take a little bit of nap, and I had started having a ton of back labor and just kind of cramping in my back and really uncomfortable. So I decided to stand up, use the birthing ball, just kind of move around. I think I went to the bathroom every 10 or 15 minutes because it just feels good to get up and do that at that point in time. And it was around 3:30 or so in the morning, and the doctor was there because she was helping with another C-section, or had a C-section that she was doing on another patient, and came in. And I was like, I think I'm ready for my epidural. And they're like, well, do you want to try IV pain medication first, since it's probably still kind of early? And I said, no, I think I'd rather just go for my epidural. I have a tendency to pass out or get lightheaded with certain things. Even cold medicine makes me a little bit lightheaded. So I was very nervous for how I would feel with IV narcotic pain medicine, and knew my plan the whole time was going to be for an epidural. So I decided to just go for the epidural. So they came in and did my epidural, and I got very lucky because from that point on, I felt almost nothing. Took a nice nap after that. Just kind of labored on my own. The Cervidil had come out at that point because I had continued to leak fluid since my water was in fact broken. And then they came in the morning around 8 o'clock or so and checked my cervix, and I was like 5 centimeters dilated at that point. So my nurse that took over is actually one of my good friends, and we had planned for her to take care of me that day. She actually picked up an extra shift, so she was going to be there until about 3 o'clock. So I was on a deadline. I had to deliver before 3, just since she had come in to help me. And they started Pitocin, I want to say around 10:30 or 11, just because I had kind of spaced out with my contractions. The doctors in our practice switch around 12:30 or so. So when they came in at that point, they checked me again, and I think I was like 8 centimeters. So they continued to use the Pitocin. I just labored in bed, obviously flipping back and forth since I had that epidural. And around 2:30 or so, they checked me and I was ready to push. So I still was feeling absolutely nothing. And since I'm a labor and delivery nurse, I was absolutely convinced I was going to have a C-section. So, the whole time I was waiting for them to tell me it was time to go to the OR, waiting for them to tell me there was something going on with the baby or just that I wasn't progressing. So even to get to 10 centimeters was kind of a shock for me. So we started pushing. And I think I pushed for like an hour and was like, okay. And I was talking to my friend who was my nurse, and I was like, when am I going to the OR? Because I'm sure that this isn't doing anything. I can feel literally nothing. I don't feel like I'm doing anything. And she goes, Rachel, you are not going to the OR. You're going to have a baby very soon. And she actually went and got a mirror so I could kind of see the progress that I was making, which I wasn't really sure that I would have wanted at the time. But then when she had it for me, I was like, oh, I really am doing something. Like, even though I feel nothing, these pushes are effective. And so I think I pushed for another like 30 minutes or so after that and delivered my daughter around 4:03 in the afternoon. I had a pretty easy repair afterward. So after she was born, my mom and my sister actually were at the hospital when I was laboring, and they had been in with me throughout the whole day. I kicked them out of the room when it was time to push because I was a little bit nervous and uncomfortable and anxious. And so I told my husband to text them and just let them know that the baby was here. And so he sent a text to my mom and my dad and both of his parents and let them know that she was here. Well, my mom and my sister were at the hospital. They were just in the waiting room. And so little did they know that the baby was born because my sister didn't get a text and my mom's phone had died. So the next thing they know, my dad is calling my sister and saying, I'm coming up to meet the baby. Rachel's had the baby. And she goes, what are you talking about? No, she hasn't. We haven't seen anything. And he's like, no, I got a text from Rob. The baby's here. So they then come in the room because they didn't realize the baby was here because my mom's phone had died, and came and met our daughter. And so they were probably in the room maybe 10 minutes after she was born. And my sister started being my little birth photographer, which I love looking back at those photos. And she got the reaction of my mom coming in the room and my dad coming in the room and everybody meeting the baby for the first time. And that was just really special. Especially now, my dad actually died in May. And so every picture that we have of him is even more special. So him getting to see those first few moments of my daughter's life were even more special because of that. So she weighed 7 pounds, 4 ounces. We stayed in the hospital for, I think, 2 nights, but it was like, we left the Saturday morning. She was born on a Thursday evening. So we left Saturday morning after we had her and had a relatively normal, I think, recovery. My milk came in around day 5, I think. So like Monday or so, maybe that's not day 5, maybe day 4. She breastfed really easily. I didn't really have any issues latching her, thankfully. I worked with lactation consultants at the hospital and they were super helpful. She gained her birth weight back by 2 weeks. So we just kind of did our thing. And that was my birth story with my daughter.
There's one part prior to your birth story that was pretty hilarious when you tried to have a gender reveal.
Oh, yes.
Remember that?
So when I first found out I was pregnant, I wasn't sure we weren't sure if we were going to find out the gender. So they do all the blood tests now where you can figure out gender, and we opted out of that for her because, again, at that point, we thought we wanted it to be a surprise. And then around 18 weeks or so, when I was going to have my anatomy scan, we thought we were going to move. And so I told my husband, listen, we're pregnant, like if we're moving while we're having a baby, I want to be able to plan stuff out a little bit better and figure out her room or its room, whatever the baby shall be. And so he was like, okay, well, I guess we can find out. And so I decided, let's do a gender reveal. So had my ultrasound, they put the information in an envelope. I thought it looked pretty sealed and I couldn't hold it up to the light and see anything. So they did a good job of keeping it hidden from me. And my whole family goes on like a family reunion on my mom's side at the beach every summer. And so we had decided to do it at the beach because it was a great place when everybody was going to be there together. My mom, that whole side of the family, and we actually invited my in-laws and my husband's family to come along so that they could be included. But my father-in-law all of a sudden had to travel to Japan for work, and so they weren't going to be able to be there. So we bought the flares that you can get at just Amazon or anywhere that have the color for whatever your gender is. And so to include them, we let them look at the envelope with the ultrasound photo and put the correct colored flare in the envelope that we took to the beach. So we get to the beach. It's the first day we're there. We didn't realize we were going to do it on that Saturday, but it was windy and gross and we couldn't do anything anyway. So we figured we may as well have fun and do the gender reveal. So I made my dad check with the lifeguards to see if we could light these flares on the beach because I'm a little bit of a rule follower and was afraid they were going to come arrest us or something. And so my dad asked them and he said, no, it's fine. Go for it. So my sister had gotten these cake pops and everybody was huddled around and everybody made their guesses and was holding the colored cake pop they think it was. And I had my cousins light the flare, which was a little bit tricky because it's super windy. We're on the beach. It's not raining, but it's just there's salt water and water in the air because of the wind. And so they finally got this flare lit and we see blue smoke. And so we all were like, yay, it's a boy. That's so exciting. So for a week, my husband and I were back and forth on names and what are we going to name him? And I can't believe we're having a boy and all the things. And we're driving home the following Saturday. And I was talking to one of my really good friends and was telling her it's a boy and everything related to that. And she goes, that's so exciting. How do you feel? I was like, I mean, I'm very excited. It just, I was not I thought I was going to have a boy, but was not expecting to have a boy. I kind of figured I wasn't going to have a girl. I had another good friend that's pregnant and we knew we weren't having the same gender. So I was like, oh, I guess that means she's having the girl if I'm having the boy. And something just felt a little bit off. So we went over to my mother-in-law's for dinner to kind of celebrate. My father-in-law was still out of town. And I asked her for the envelope that had the ultrasound photo so that now I could see it since we knew it was a boy. And I opened up the envelope and I'm actually standing in her little foyer at this point in time. And I looked at the photo and I just go, Rob, it's a girl. And he goes, what do you mean it's a girl? I said, this photo right here, it says girl on it. And my mother-in-law runs in the room and she goes, no, it's not. And opens the envelope a little more. And there was a piece of paper in it in huge letters that said it's a boy. And so my in-laws are not from this area. So they aren't used to looking at ultrasound photos or anything like that. And if you've ever looked at an ultrasound photo, they're tiny. They're like I don't know, Kelly, what do you think? 2x2 or 3x3 size. Yeah. And it's like size 6 font that's written on there. So it did say girl with 4 exclamation points, but why would she ever have looked at that when there was a big piece of paper that said it's a boy on it? So I actually went to work the next day, very unconvinced as to what gender I was having. And Kelly was there and called one of the high risk doctors where I had gotten my just normal 20-week anatomy scan and said, there was some confusion with the gender. What is it? And he runs downstairs. Now, this is a Sunday, mind you. So he was here to see another patient, but graciously ran downstairs, pulled up the photos on the computer, printed an 8x11 and said, she is sitting on the probe. There is no way this is a boy baby. And so I was still like 15% unconvinced that it was a girl, but super excited nonetheless. My husband and I did not care the gender. We were just very excited to be pregnant and having a baby and everything. So it was quite a surprise, but I did say right before she was delivered that it would no longer be funny to joke that it was a boy, because at that point I was not going to be thrilled and laugh about it like I did, 20 weeks earlier.
That's fair.
But it was quite a surprise because we were at the beach and my whole family thought it was a boy. And then I did my little gender reveal post on Facebook and said, baby girl Roudik coming December 2018. And I had texted people, but I couldn't reach everybody. The chain of talking goes so quickly. And so I did get several texts like, what? Girl, we thought it was a boy. Are you tricking us? And so it was a little joke for a little while with the family, but She definitely is a girl. And the name was easy because it's just our grandma's name. So that little question of what are we going to name her or him went out the window. And so, now she's 4 and thriving and awesome.
Yes, she is. And then I had my son in the same room the next day.
24 hours later. I just
thanks for keeping it warm for me.
Yeah. It was funny because one of the nurse who was in charge the day I went in for Molly was, I think, the nurse that delivered you. And so she had to close the door of the room because there were some people kind of stalking the hallway trying to say, can we switch to this room? Ours smells a little bit, or nothing was wrong, but they just had to pretend there was a patient in it. So it was good we kept it occupied because...
Well, they had it all set up and they had the little Harry Potter themed stuff in there.
Exactly.
So
it was ready for us.
This room is taken. Right. Yeah, because I think we both just agreed on which room we wanted.
Right.
And we're just like, this is our weekend. This is the room we're gonna do, and this is it.
Exactly.
I remember because I clocked out. I came in and clocked out and went and had a baby. But the day before I worked a full shift, and that's when you delivered.
Yeah. I think you were like, okay, thanks for having this room. Now it's my turn. I was like, well, good luck to you.
Bye,
because
thanks,
I had
tomorrow.
A great day. So.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's kellyhoff.com/empowered. I'm honored to be a part of your birth journey.
I remember sending one of our doctors in there who notoriously would always yell to get moms to push. And the nurse that was in there with you had come out saying she thinks she's going to have a C-section. She's nervous. She doesn't think she can push this baby out. And so this doctor was like, should I just go and like yell at her a little bit? And I was like, I dare you. I don't think he even heard it.
I thought
but he
I
goes
heard
to the
something
door
from the hallway, but I don't know if I
Yes,
fully
it was in the hallway
remembered.
because he was scared. I was just cracking up at the desk. He's like, she's going to be so mad at me. I was like, no, she's not.
That same provider
and he's
did
like,
come in earlier in the morning and say, thanks for the bagels, eating a bagel as I was not able to
I
eat
remember
with my
that
epidural.
too. I remember that too. But he was like, come on, Rachel, get mad at it. Everybody just at the desk was just cracking up.
I know. It's like I had my whole little cheer squad behind me, but didn't even know it because nobody was in the room except the nurse that was taking care of me.
Right.
So.
Yeah. We were all out there cheering for you watching the strip, but we didn't want to come in and like break your concentration or anything.
You could have. I felt nothing. So.
Right. Yeah. At that point. Well, okay, so that was a pretty straightforward delivery. The next one got really exciting. So you had a couple years to decide your boy name.
We did. Yeah. So I actually had a miscarriage between my daughter and then my son, who was my second delivery.
Oh, I'd forgotten about that.
Yeah. So right in March of 2020, when the world was shutting down, I actually was in the middle of going through a miscarriage. So it was interesting to see how everything changed in the real world and like the doctor's world, because you went from nobody wearing a mask to going in weekly for blood draws and no one being there to now maybe we should wear a mask to now masks are required. So it was, a hard time. I had horrible anxiety just because of everything that had been going on in the world and at work and with my body. And then, so I went in weekly for blood draws. And then right as I got all my levels back to normal, I actually got pregnant with my son. So I was very fortunate that even though that happened, we were able to get pregnant a third time pretty easily. So I had a rather uncomplicated pregnancy with my son, except for the fact that I was pregnant, working in labor and delivery in a hospital in the prime of COVID, when things were changing on a daily basis on what do you do if you have a COVID patient, or what should you do here? And, I wasn't really open about telling people I was pregnant immediately, just since I had the miscarriage between the kids, and was very nervous that would happen again, and was very nervous about taking care of COVID patients because I didn't want to get COVID while I was pregnant. But, we all kind of just stuck together and did the thing and made our way through. And so at the point in time when I had him was January of 2021. And at that point in time, anyone who worked outside of the house had to quarantine for 2 weeks prior to delivery, because that way they could, do their best to ensure you wouldn't come in with COVID. Back when we still thought you needed 2 full weeks before you would get COVID or have symptoms. And most of the patients that we took care of during COVID were asymptomatic. And I think we just coincidentally found it because we tested everyone. But I actually worked in triage, so seeing any patient, COVID or no COVID, up until I was about 34 weeks pregnant, at which point I kind of said, no, I think I'm done. I don't want to put any risk towards me or the baby getting COVID, since that was the nurse who swabbed every patient coming into the unit. So I had my schedule lined up. I was in charge quite a bit at that point, or on the floor, since I wasn't in triage anymore, which was kind of my happy place. And so I was in charge I had 2 shifts left. I had a couple days of a break, and then I had 3 more shifts, and then I would be out for 2 weeks, and figured I would have another induction just after my due date, like I did with my daughter. I hadn't even set it up yet because I figured I'd do that when I got to like that 38 or 39 week appointment. And so I was at home the night before I ended up delivering, talking to my husband and just saying how much stuff we had to do still. I can't believe I was 37 and 1 at that point. I'm so close to delivering. There's so much to do. We need to get his room ready. And we knew it was a boy. We found that out early with the blood work, since the little snafu that was the fun part of the story the first time. And we had the crib set up. We had a carpet on the floor, but I had no clothes ready. I literally think that was all we had done. There was a chair coming for his nursery that wasn't going to be delivered till the weekend, I believe. And so I was just like, I need to get stuff ready. And my husband's like, Rachel, don't worry. Everything will be fine. You'll go to work the next 2 days. You have a couple of days off. Your mom is also off on that Friday because she doesn't work every other Friday. You guys will go through all the clothes. We've been gifted so many hand-me-down clothes from friends and coworkers for boys. So you'll go through all those clothes. You've already washed them. You'll put them away and get stuff organized. And then you'll work your 3 days and just get to hang out until you delivered. So my naive self was like, okay, great. That sounds perfect. Went into work the next day. I was in charge and it was incredibly busy because of course it has to be really busy in the end of January. And we had a lot of scheduled stuff, but it was just, I think almost every single room on the unit was full. And because it was in the middle of COVID, we actually saved 2 rooms for if there was a COVID patient. So there was one room where they would labor and one room where they would deliver. And I think at that point, those were the only 2 rooms that were open. And so I was actually helping in a delivery because as the charge nurse, you are the second nurse in almost all of the deliveries unless somebody else goes instead. And the baby had come out. I remember I was getting ready to start Pitocin, which is normal for people to get after delivery to help with bleeding. And I felt this little pop and I was like, oh, this seems familiar, thinking of maybe that's my water breaking. And so, thankfully I was on my unit. I was in a room that was towards the end of the hall, not close to the supply room. So I just left the delivery and told them I'd be back in a few minutes. They were okay for me to leave at that point. It wasn't like a situation where I wasn't able to leave. So I stepped out of the room and I stopped in the supply room and got a couple of things and went to the bathroom and figured I would just see if it was my water that had broken. And I remember, this may be gross, but I remember pulling my pants down and it was just blood. So I was definitely not expecting to see the bleeding that I saw at that point. So I was a little bit shaky, but I kind of got myself cleaned up and had put a pad on, and I went into triage to talk to one of our coworkers who was the triage nurse that day. And I have done this schedule on our unit since I think it was like May of 2020. So I planned really well that if I was in charge, there was a backup charge nurse every shift, just in case something happened. And so the nurse that was in triage could also be a charge nurse, and she was the backup that day. Just she didn't know it yet, nor did I think that it was going to be needed.
She was about to find out.
Very much so. And so I just went in and I said, so I'm bleeding. And she goes, well, what do you mean? I just said, well, I thought my water broke, but I'm bleeding. And she goes, Rachel, did you call your husband? I said, no. She goes, Rachel, did you call your doctor? I said, no, I came and found you. So she goes, so this is what you're going to do. And it's things, as at this point, I'd been a labor and delivery nurse for 8 years now. So it's things, as an experienced labor and delivery nurse, or just a, patient who's been pregnant before in general. But when they happen to you, you just kind of pause and freak out a little bit. So I knew which doctor was on call for my practice, and I called her first, and I went into a room and closed the door, and it was the only room that was open on the unit, but I just wanted a little privacy. And I said, so I know I'm cheating by calling you directly, but I just wanted to let you know that I thought my water just broke, but I was actually bleeding. And she said, okay, well, have you been contracting? And I said, well, to be completely honest, yes, but I haven't sat down or eaten. And at this point, I think it was like 3:00 in the afternoon all day because it's super busy. And she goes, okay, no problem. She goes, is the baby moving? And I said, honestly, I don't know, because again, I've been running around like crazy. And at that point, I felt like a horrible mother because I was doing everything I could to make sure the unit ran smoothly. And I had some new nurses that were getting things ready for like a twin C-section that they'd never done. And I promised them I'd be there and all the things, and was trying to make sure everybody had the help they needed. And here I was not even paying attention to if my baby was moving because I was so busy. And I said, I honestly don't know. And she goes, it's okay, Rachel. We're just going to have you go on to triage and we'll put you on the monitor. We'll probably get an ultrasound and we'll see what's going on. So I was 37 weeks and 2 days, super unconvinced that I would be having the baby that day, just thinking they were going to kind of check me out. So I had my 36-week checkup the Friday before. So this was a Thursday. So I had my 36-week checkup the Friday before, and they had checked my cervix and I was closed. So I get into triage and they check me in and they put the monitors on me, and the baby looked super flat on the monitor, which as a labor and delivery nurse, you don't want to see your baby looking like that. And then the contraction monitor showed that I was contracting like every minute. And the nurse, who now was in triage and in charge, because I had to give her that phone, goes, "Are you feeling these?" And I said, "I mean, I'm kind of crampy and I've been feeling my stomach get tight, but no, I'm not uncomfortable." And I was like, "And by the way, I didn't take my underwear off because I'm still bleeding." And I was like a little uncomfortable to do that. And she goes, "No worries." So she opted to put an IV in right away to just start giving me some IV hydration, just because she knew I hadn't eaten or drank anything really all day. She knew that she saw that what the baby looks like on the monitor. And so she went ahead, and at that point, the doctor called her just to check in. And they were like, "Well, did you check her cervix?" And she goes, "No, because she's still bleeding quite a bit. But just so you know, the baby looks pretty flat on the monitor and Rachel is contracting like every minute." And so she said, "Okay, well, I'm on my way. I should be there within like 20 minutes. So in the time it took for her to get there, they had gotten my IV in. They were giving me some fluids. He looked a little bit better on the monitor, but I still was contracting and still was bleeding. Not like running down your legs like a period, but still just like when you think your water breaks and you keep leaking, instead of, clear fluid, I just kind of had blood." And so the doctor comes in and checks me, and I was like 2 centimeters dilated. I had like a bulging bag of water, and she said, "So Rachel, it's baby day." So we went ahead and kind of changed gears from getting an ultrasound and seeing what was happening to letting me labor / moving things along a little bit quicker, just because of the little bit of bleeding that I was having. So I called my husband, who was at home with our daughter, because this was one day that our childcare was a little bit funky. We had a nanny that would watch her when I worked, but she was actually out of town. And so we had family alternating watching her, but this was a day where he was going to just watch her in the afternoon, let her nap, and then, finish his day early, finish working when I got home from work type of thing. So he kind of freaked out, got confused as to what the plan was going to be for her, tried to get creative. And I was like, "No, just take her to my mom's house. They're 2 minutes away, and just come to the hospital." So he did that, and he came in. And at that point, I had moved into the only room that was left on the unit, since I decided I needed to go into labor in the middle of my shift, and took that room. And so at that point, it's like 5 or 5:30. The only birth plan I had clearly had already gone out the window, because I thought I was getting induced. But the only other thing I was adamant on was that I wanted an epidural. So there's this one specific anesthesia provider that all the nurses really liked. And I wanted to know if he was there that day so he could do my epidural, because the anesthesia provider that was on the unit that day, there was nothing wrong with her, but I just, was afraid.
You got to have your people.
Exactly.
You want your people.
Thank you. And so the doctor actually called him and said, "Hey, Rachel's here. She's in labor. Can you come up and do her epidural?" So I was still contracting. I was not feeling very many contractions, but he went ahead and came up and put my epidural in. So I was nice and comfy, at which point she then broke my water. And when she broke my water, a lot of times you wait for them to tell you the color of the water to know, did the baby poop before? Is it clear fluid? Should I expect NICU to come if the baby passed meconium prior to delivery? The shifts had changed already. So there was a night shift nurse taking care of me, who I love. And she and the doctor were just like, "Rachel, we can't really see the color of the fluid. It looks a little bit bloody." And I was like, "Okay." I was like, "Well, is he okay?" And they're like, "Yeah, he still looks good on the monitor." So about an hour and a half after they broke my water, they came in and checked me, and I still wasn't quite ready to push. I think I was like 6 centimeters. Now, this was kind of all, I think, on my own. I don't really think they started any medicine like Pitocin or anything like that. But at that point, they decided to just give me a little Pitocin to keep things progressing, just since I had bloody fluid. I had been bleeding before, and they didn't want to risk anything with me or the baby. So they started a little Pitocin. She came back an hour later, checked me, and I was fully dilated and ready to push. And I had like a little window in my epidural that made it really uncomfortable, like in my left lower abdomen, like right where your thigh meets your stomach. And so I remember saying, I think we might need to get like a little extra medicine. Like I can't decide. But then at the same time, I started feeling a ton of pressure. That was kind of that signal that maybe the baby's coming. And I didn't feel anything with my daughter. So this was very surprising to feel what this pressure was going to feel like. And so, like I said, they came in and checked me and I was ready to push. And thankfully, once they got everything set up, I only pushed like 1 or 2 times and my son was born. And he was 6 pounds, 6 ounces. He had a lot of vernix on him because he was a little bit early. So he was a little guy, smaller than my daughter, but came out feisty and crying. And when the placenta delivered, the doctor was like, so I definitely think you had a little bit of an abruption, which was the cause of the bleeding. And my nurse mind had already gotten to this point, like, oh, maybe I'm having an abruption. Maybe that's what's happening. But why am I doing this? Like, I didn't hit my stomach. I don't think anything happened. I was grateful to be able to have another vaginal delivery because a lot of times if people are having a placental abruption, they don't get to have vaginal deliveries. But I think the fact that it was my second baby, things moved along pretty quickly. The baby was reassuring on the monitor.
You were in the hospital when it happened?
Correct. I caught it immediately, probably helped to get me to that vaginal delivery. But I think if I had to have had a C-section, I wouldn't have cared. I just wanted a healthy baby. The doctor who delivered my son was actually the same doctor that delivered my daughter, just coincidence. And she actually was the doctor that I had seen that helped me with my miscarriage. So it was kind of like a full circle. She was there for my daughter. She helped me through my miscarriage, and then she helped deliver our little rainbow baby. So it was very special to have her there for that.
Yeah. She's a great one,
she
too.
She is, yeah.
They all are.
They are.
Well, so did we ever have any kind of thoughts on what may have caused the abruption?
I don't think we ever had any thoughts. You know, I had a toddler at home, so I'm sure she, kicked my stomach unintentionally. Who knows if that did anything? That often doesn't mean a thing, but could she have done that? Yes. Could it have just been a coincidence? Probably. But yeah, there was
Your
never
job had nothing to do with it.
Nurse curse. So yeah, no.
Well, I mean, just the physicality of it.
That's true.
Just all the stuff that we're doing. But,
that's true. No cause, but they did send the placenta to like a pathologist to kind of look at, and it did come back with just a partial abruption. So thankful that it was not as big as it could have been. Again, thankful for that healthy baby that I got to bring home at the end.
Yeah. So I ask every mom, if you could go back and talk to yourself and tell yourself anything prior to either of your pregnancies, what do you wish you could say to yourself?
I think with my daughter's pregnancy, I wouldn't really go back and say anything different. It was my first pregnancy. I was really, really lucky. Everything went smoothly. I think with my son, I was just so nervous because I'd had a perfect pregnancy, as much as you can say that, I know that's not a great word, but as much as you can say that with my daughter. And then I had that miscarriage in between, and I never really thought I'd be that person. It's 1 in 4, it happens very frequently. You never really think it's going to be you. So I think something to give myself a little bit of the breather that he was going to be here and I was going to bring him home, because you always wonder if that's going to happen when you've had a loss. And especially when you work in the field that we feel, there's always that thought in your mind, unfortunately. And so I think it was just to, we wouldn't have him if we hadn't have had that. Not that it makes it any better or easier, but I think, I can't imagine not having him be here, because he's the funniest little 2-year-old now who has these crazy facial expressions and is amazing.
Yeah, for sure. The other thing that I want to ask, because as a labor and delivery nurse, that sometimes it's the hardest thing in the world to try to teach someone how to push. And everybody has something that just clicks for them at some point that helps them realize, oh, this is how I need to do it. So was there anything for you that made you kind of click in and realize that this is what I need to do?
Well, I think with my daughter, I had an amazing epidural where I felt literally nothing. So I just kind of had to keep thinking, what did I do? What do I teach my patients? What do I tell them? and kind of like had to focus on that and focus on not using my face to push and just that one, focus on pushing where you need to push. And I think the fact that my friend brought in the mirror for me to see that I was actually making progress with her was really helpful. Because again, I felt nothing.
Yeah.
With my son, I had this uncontrollable pressure. And I think that was what was really helpful to push with. So I think if I could tell anybody something, it's just to trust your body, listen to the nurses, because they really are helping you and have done this before and have taught people how to do this before. And even if it takes 30 minutes to figure out how to push, they're going to tell that to your provider if they're itching to say this has been too long. They're going to be like, well, she didn't really get to the right point in pushing for 30 minutes. So don't count that as 30 minutes into her push count if that's what they're doing, and use a mirror if it doesn't freak you out. Even if you don't want to see the delivery, use it to show yourself you're powerful and you can do this and it's working.
Yeah.
So that's something that I would, tell people.
Yeah. If they don't want to use the mirror, which, it does freak some people out.
It does.
If the dad can look, sometimes his reaction
that is a good point.
The best thing ever.
I also encourage people to touch their baby. That sounds kind of gross to some people, but for some, it's that little bit of encouragement if they're so exhausted to be like, no, it's really right there. Like you're so close to meeting this baby. You can touch it, just touch it. And, I'll offer them something to wipe their hand with after if they feel like that's really gross, but it helps people.
Yeah. But sometimes they go into beast mode after that.
Yes. You're like, you felt it, now just go.
Yeah. Well, is there anything else that you want to share? Anything else that you were kind of itching to tell?
I don't think so. I love listening to birth stories and birth journeys, and I love telling my story. So thank you for listening.
Yeah, I feel the same way. And I think also when we first had our daughter, my husband had said, we need to sit down and do an interview. And I still haven't done it. I've interviewed a lot of people, but at the very least, everybody that I've interviewed has their birth story recorded so they can go back and listen to it. So that's super fun.
Yeah, no, thank you for that. And you totally should do it for yourself.
I will. I just need to find somebody to interview me. I don't want to just sit and talk to a computer.
Yeah, that makes sense.
All right. Well, Rachel, thank you so much.
Thank you.
I appreciate you telling your birth story. It was fun to relive that.
I thank you again for listening.
Let's face it. Moms are busy. We're so busy taking care of others that we rarely have time to take care of ourselves. I'd love to simplify that for you. I'm offering a free 15-minute hair care or skincare consult to help you find an uncomplicated routine using clean, vegan, anti-aging hair care and skincare products that follow the strict EU standards for safety. For your free consult, just send me an email at birthjourneysrn@gmail.com and we'll schedule a call. I'm excited to be a part of your self-care journey.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.